Good morning, everyone. My name is Gina Gutman. I'm the Senior Vice President at the Staten Island Economic Development Corporation. And I'd like to welcome you to our session this morning, or now afternoon at noon. Today's session is the prolonged effects of COVID-19. And what I'll be doing is sharing a video that was produced by our friends at Staten Island University Hospital and Northwell Health. We'll be hearing from Dr. Strange, Dr. Maniatis, Dr. Gutt, and Dr. Sullivan. And we will now go to the video.
So the CROWN program was established to help patients that have been recovering from COVID obtain resources to help them get post-COVID care throughout the Northwell organization. Specifically, at Staten Island University here, we've started a clinic, the Post-COVID Recovery Center, specifically to address the complaints that patients might have related to COVID itself. So typically, we're taking care of patients that have had COVID in the past, have been exposed to COVID, or potentially were just even afraid that they were in contact with COVID without a proper diagnosis. In terms of the COVID patients that we would see that had COVID prior, we take care of everything from patients that were mild and sent home without further treatment to hospitalized cases that ended up being hospitalized for a prolonged period of time, including patients that might have been in the ICU across the spectrum. So any type of COVID patient can be seen here in the clinic. So this program itself is designed as partially as a way to treat patients and also partially as a way to investigate and follow these patients long term. So our goal here is to track patients long term to look for problems that might have arisen from the acute COVID infection that might have been missed prior. So complications that arise, say a month or 3 months down the line, can be followed here specifically to address those problems as they come up. So typically we won't see patients when they're acutely infected. We don't necessarily follow patients that just got diagnosed with COVID. In this setting, we're seeing patients that have had at least 2 weeks since their diagnosis of COVID, since at that point, we're presuming that their viral loads are non-existent, that they've already passed the acute reaction of the COVID virus itself. Anybody that might have persistent symptoms related to COVID, so patients that still have lingering cough, changes to their skin, changes to their hair, changes to their gastrointestinal symptoms, shortness of breath, fatigue. Patients sometimes still have persistent diarrhea after COVID. The acute infection itself typically didn't always have that, but classically we refer to COVID as being fever, cough, shortness of breath. But unfortunately, we found out as time has passed that there's actually a lot more to those symptoms than we thought early on. And we do have lingering symptoms long-term with some of these patients that are sometimes only nagging complaints, and sometimes they can actually be quite debilitating long-term. Some patients are even unable to return back to their normal lives because of these persistent symptoms that keep bothering them. Sometimes even these patients don't necessarily have any symptoms after COVID, and they think they've entirely recovered fully, and they'll come back to us with strange things like heart attacks or strokes that they were otherwise low risk for, except for this recent history of having been exposed to the COVID virus. So typically, that's one of the symptoms that we see commonly with the acute infection, the loss of the sense of smell, which unfortunately does persist longer for many patients that have COVID, and that's common here as well. So what we typically associated to be just an acute infection of the lungs, we've realized nowadays has much more wide sweeping implications long terms, including patients having strokes, heart attacks, blood clots to the lungs, fatigue, rashes, numbness and tingling to all parts of the body, other skin changes, hair loss. So the largest amount of patients that we have that we're referring, or I guess the most common type of presentation that we have here is mostly related to cardiology complaints, pulmonary, or hematology. There's a lot of patients that present to us with fatigue or with blood clotting type disorders that we will refer to them. So the program itself has a structure that's kind of all-encompassing. One place, one-time approach to managing these COVID symptoms. So typically throughout the patient visit, you'd be examined by myself from the medical perspective. And I also have specialists here available within a clinic, either in person or via telemedicine, to address other complaints and other concerns related to COVID itself. So while here, every patient would be seen medically, they would also undergo a neuropsychiatric evaluation and also a physical therapy type of evaluation as well. So they're going to have a physical therapist evaluate their functional status here. In general, we're accepting really anybody that wants to come in or as a telemedicine basis. So if somebody doesn't feel comfortable coming into the office, they are absolutely available to have a telemedicine visit with us as well. So we have multiple doctors in our network here that are all coming together to help us with this clinic. If I were to need, say, a hematologist because of clotting phenomenon that occurs with COVID, I can actually have a hematologist conference in during our visit to do a consultation on the phone.
Sure. So this year, 2020, has been a very interesting year with our new disease called COVID-19, SAR coronavirus. It started right at the beginning of March. We had our first case that hit our hospital, and we exponentially grew with the number of patients who were admitted, both north and south, to a number that approximated close to 400 patients at our peak, and close to 160 of those patients being on respirators on one specific weekend, which was, I think, around the first weekend in April. Patients were coming in both north and south. We created units to make sure we took care of these patients. We had to suspend surgeries in our hospitals at that time, other than emergent surgeries. We created critical care units in other places on floors with teams of people that worked together. We brought in and worked collaboratively with other specialists who weren't typically involved in healthcare in the hospital or in medical care, and utilize their services and expertise, like our surgeons who ended up working with us, putting in specific central lines or doing specific procedures that helped us in terms of getting the appropriate medications involved. We used our psychiatrists and our psychiatry teams to help with our communication. We used some of our ambulatory doctors in places where they could also help with communication with patients and families, since families were not allowed in the hospital during that time. And it was a time that put a lot of stress on all of our staff. But I have to say that the Staten Island University Hospital family and team worked so well together. We took care of every single Staten Islander that came here. I'm proud to say that we did not have to take a patient and move a patient off Staten Island. It was the mission of our administration, led by Brahim Ardolik and our board, to ensure that we took care of every single patient, and we did. And I'm proud of the team I work with. At that point, I was at the South site. And we went from a hospital of being 95 patients to a hospital being of 140 some odd patients. We went from a critical care mass of about 16 to a critical care mass of 44. And every single patient was taken care of. So yeah, my role in primary care is I run a group as part of our Northwell Health Physician Partners called University Physicians Group, and we're a division that we cover across Staten Island, both from the Verrazano Bridge to the Outer Bridge Crossing, and a couple of small practices in Brooklyn of about 35 doctors. Mainly primary care, meaning internists, family practitioners, some rheumatologists involved there also. And we are your first-line doctors in the community. We do the essential care in the community, from wellness care to chronic disease management to just, overall monitoring and watching your health care over the years. During this time, because of COVID and because of infection control issues, the offices actually shut down. But we didn't shut down. We went on to a virtual platform. We went on to do what's called telemedicine. And in the healthcare system, we were one of the most successful telemedicine practices in the system, achieving seeing about 70% or maintaining about 70% of our volume during that time, switching from a quick transition of inpatient, in-person visits to remote visits via whatever teleplatform we were using, either video and or audio platforms. This really worked well because it kept patients engaged with their health care, kept them on par and on course for managing their blood pressure, their diabetes, or whatever it was. And and the government actually finally paid for this, so that was an incentive there too, but that wasn't the main incentive. And we then transitioned back now to having our offices back almost to full capacity. Again, full capacity in light of making sure that we properly distance in the offices and nobody's waiting in a waiting room for too long period of time. And we're happy to see our patients in person again. And we're utilizing the technology that we utilized during COVID and learned during COVID of virtual medicine in concert with that. But obviously we want to be hands-on. We need to listen to your heart. We need to have the ability to speak to you in person and do what's necessary in that point of view. But in terms of reviewing labs and maybe doing some education, maybe the virtual platform will continue to work there too. So we know in COVID, and we learned this early on, that there were certain risk factors with COVID disease. Those included elderly patients. So we want to always protect our elderly. And elderly, depending on how you define it, because I fall into it, during COVID was 60 years of age and older put you at increased risk. But obviously what we were seeing here, 70 and 80 and older were your biggest risks. Added on to that was the issue of obesity, hypertension, diabetes, heart and lung disease, for whatever that meant, asthma, COPD, or congestive heart failure. These were all the diagnoses that put you at risk. So during that time, we wanted to make sure that we managed these very aggressively and very appropriately so that we minimize the risk in case you were to get COVID disease. So it was important to maintain a relationship with our patients in the community, which we did. And despite that, we still had 300-400 patients being in our hospital setting. Now, as we transition out of the acute phase of COVID into this chronic, still out there, being very careful, wear your mask, social distance, know your risk factors. We're now into the fall season, which begins our flu season. Good news with this is that when we look at Australia, which is where we typically look at what happened there in previous months, it appears that the flu season was not as severe as it previously be. In fact, some people would say it was almost non-existent. It was there, so I don't want to use that term. But important in that is, as we promote every year, and as has been said many, many times over many years, the flu vaccine, here we are trying to create a COVID vaccine. The flu vaccine works. It doesn't work 100%, no. Does it work and help 50, 60, 70%? Yes. And it does diminish the flu activity in you if you were to get the flu, and it does decrease the transmission rate, which is what we're looking to do. However, the other thing that was clear is putting on your mask absolutely decreases the ability to transmit not just COVID-19, but probably influenza and rhinovirus and all the other things that are transmitted. And that may be one of the reasons why it was so good. Absolutely washing your hands, washing down the environment, doing all the hygienic stuff that we have. Here I have my Purell sitting on my desk, and constantly doing all the infection control things that we need to do regardless of COVID. So, in summary, take your flu shot. It's there. We're looking for a COVID vaccine. The flu shot is safe. It's been proven very, very safe over the years. I've taken mine every year for 30 years. I've given out thousands of flu vaccines. Yes, there are sometimes little reactions with local redness or little sniffles. The old thing about Guillain-Barré is an old thing. We don't see that anymore. That was with a particular lot 20, 30 years ago. It is safe. It's effective. It works. Do that in concert with your masks, and we will have hopefully not a dual pandemic here, which is what we're trying to avoid. To learn more about our safety protocols and understand what it is we're trying to do to really keep this diagnosis at bay and to also keep the flu as minimum as possible, Staten Island University Hospital with Northwell has a safety link that deals with infection control precautions. And so visit our safety link on the Northwell SIUH website. So again, to all of my neighbors, and Staten Island is my neighborhood, but I specifically live in the 10307 area code of Tottenville. And the last week, we know that Staten Island has seen an uptick in COVID disease and activity. And we've specifically seen a couple of area codes tick up, and Tottenville being the biggest one on Staten Island, the biggest increase in percent. We think part of this is from, and I know part of this is from because I live there. I'm a neighbor. We need to wear our masks. We need to stay out of crowded environments if we can for prolonged periods of time. And if we need to be, we need to do the things we just spoke about. Wear a mask, stay 6 feet away, wash your hands. And then if you're concerned, get tested. The city just set up a testing site on the grounds of the Conference House Park. It's a simple, easy test. It's a quick test, in fact, so you get your answer immediately. You also can go for testing right behind Staten Island University Hospital at South Beach for the traditional testing that was done. But I think to my neighbors and my friends and my family, let's be smart. Let's have common sense. This virus is not political. This virus doesn't know Republican, Democrat, doesn't know black or white, doesn't know male or female. It's an American virus. It's an international virus. It's a world virus. It's a pandemic. And if we don't follow the rules that the scientists have put out there and told us, which is wear your mask, clean your hands, stay 6 feet away, that doesn't mean we need to shut down the world. That doesn't mean we need to not see our family and friends, but we need to do it smartly and with some common sense. And I think if we follow those rules, unfortunately, probably for the next 6 months, year, maybe 2, we're going to have to live in a very different world than we once used to. But hopefully, with a lot of prayer and with a lot of good science and maybe a vaccine, we will get back to some normalcy with at least minimizing the damage that it can do, meaning hurting our neighbor, our family, anybody else around us, and we don't overwhelm the hospital as we did, as what happened here in April and May, because that was not an experience that I ever want to live through again. But if we have to, we'll do it. We're here to help everybody.
Going crazy. I'm like, we're all tech. We're on the group. You weren't on the group text.
Our current environment is both an unprecedentedly complicated and stressful one, and also poses very practical, real obstacles to our community with respect to their physical and mental health. We have made many efforts to encourage people to seek out appropriate care. At the same time, we're recommending, by and large, that they maintain a degree of isolation. Those are, in ways, contradictory messages, but it points out the creativity and the determination we all have to use to try to know what we each need to maintain our health and to find a way to access the resources, the network of supports that we need. With regard to mental health in particular, as we have stressed before, it's important that people address the degree of isolation that they're experiencing. That isn't always going to be easy. Social media contacts are certainly one temporizing measure, but over time, it's not going to be adequate. We're already several months into this pandemic, and all reasonable scientific evidence suggests to us that we will be having to observe precautions for at least several months more. In that time frame, we as individuals, if we are not part of a significant and satisfactory social support network, we need to be creative and assertive on our own behalf to look for support from community groups or healthcare providers to find ways to battle the isolation that we may be experiencing. That can mean creating impromptu, safe social groups. Sometimes people are calling these pods, which may be appropriate for individuals who are isolated. Families have been doing this in order to provide opportunities for their children to have at least some degree of social contact as we try to work through this significant health crisis. In addition, it's important that people maintain their self-care, and that includes getting exercise, good nutrition, and avoiding substance uses. With that said, we know that substance use has increased over the last several months. Sadly, we are learning that there are increased rates of overdose deaths across the country. And at the same time, although our services have seen an increase in referrals, we know there are many people we're still not reaching. We encourage family members and friends to get information, to reach out to groups, be it AA or other substance use advisory groups in the community, as well as local public health resources and healthcare institutions, to get information about what steps you can take and what resources are available. It's no good if we eventually find a vaccine, but in the process lose people to substance use or to other health consequences of the kind of stress that we're observing through this process. I am concerned about the impact of continued necessary social distancing on important rituals of our culture and our family lives. The holidays occur in the late fall and early winter for complex reasons. Some of them are cultural. But part of the reason they're there is that this is a difficult time of the year for all of us. As days get shorter, there's less light. All of that is stressful with respect to its effect on our moods. And holidays are a way in which we help to mediate some of those effects. In addition, for many families with kids who are away at school, Thanksgiving and Christmas are the opportunity they have to reconnect. And knowing that many college students, for instance, are not having an easy time as they are, even though at school, having to observe social distancing, and in that way disrupting many of the normal social rhythms that are such an important part of college life. Nevertheless, the CDC and our other health authorities have strongly urged us to avoid large gatherings through the holidays. It's going to be a difficult year this year. We know that one of the reasons we're seeing surges in many states across the country, fortunately less so in New York, because I think given what a difficult time we had here in the spring, people have been very much more cautious than they may have been in other parts of the country. Nevertheless, it's important everywhere for us to avoid any social exposure that isn't absolutely necessary. Families are going to have to make individual decisions about this. But we know, as I was saying earlier, that the reason for some of the surges elsewhere in the country had to do with college students who had been on vacation and came back, or were going to college from other areas. And we're worried that if those students return home again or socialize with one another, it's not just the fact whether they will get ill. There are a small number of young adults who do get seriously ill with COVID-19. But from a public health standpoint, the bigger risk is they're passing active infections on to more vulnerable populations. And that's something that we all have to take seriously in the months ahead. It's especially hard on children of any age. I think depending on the age of children, families face different kinds of stresses. We know how important social interactions are to adolescents. At the same time, play and appropriate social interaction is important to young children as well. It's difficult to find an answer to this. Schools have tried hybrid models. Those are working in some places and not in others. I would recommend that if it's feasible, if families can work with a healthcare provider to understand how to create a safe social group, to understand what that means. As I alluded to earlier, sometimes they've called these pods, in which families agree to certain requirements that will protect them and their neighbors or community members so that they can have at least a limited degree of social contact. That seems to be a reasonable approach endorsed by many health professionals, and it's at least a way of getting through these next several months. Beyond that, it's very important for families to spend time together and to be aware of the degree of stress that's present in children that they're not going to be talking to us about, but it's still there. And how important it is that parents can be reassuring to them about the fact that life will get back to normal before too long.
– 2020 has been an amazing year at SIUH and Northwell. I want to take this moment to thank each and every person, administrative, clinical, bedside, that has worked to take care of our patients. And I just heard some information about a Florida hospital where about 30% of the staff resigned after their COVID crisis because they basically felt that they didn't sign up for this type of problem. When I heard that, I said, that's interesting. They didn't sign up for it, but Northwell was made for it. And that's what I thought about at the time. Our staff just saw the problem, faced it head on when the COVID crisis hit, and did what they had to do. We had very few people retire. We had very few people give up. We conquered this first surge. During the surge, we actually did quite a bit of work. We used some of the downtime in other areas of the hospital to clean up, to units, to complete construction projects. So everybody chipped in. We had psychiatrists that were working in critical care units to transmit information to patients because our other clinicians were just too busy to do so. We, as part of Northwell, never really thought we would be without equipment we needed, such as PPE or mechanical ventilators. We came close at times, but never one day did we do without something we needed, which is the advantage of being a part of a huge health system. And I thank everybody, not only at our hospital, but at the other Northwell facilities that helped us. And I want to thank our staff who helped other Northwell facilities when they were temporarily overwhelmed. I'm proud to hold the position of medical director at this facility, and I am very proud of the cooperation between all the different departments and divisions at this hospital. I want to thank our community for chipping in, understanding the difficulties we were having during COVID crisis, and as we come out of COVID crisis and possibly face a small resurgence and the flu season, I want to remind everybody to be vaccinated. We do not want people with influenza-like illness in our emergency rooms when we might have an excess number of COVID patients in our emergency room. And remember, no matter what we see going on, in the magazines, television, newspapers, science is science. wearing a mask and social distancing decreases the transmission of this disease. And remember, even if COVID disease wasn't a possible problem, a resurgence, there's no reason to get the flu. The flu vaccine is not perfect, but it's good. It decreases the chance that the recipient will develop influenza, and it certainly, the strongest evidence is that it certainly decreases the death rate and the hospitalization rate. So there's little downside, if any, to receiving a flu vaccination. It'll keep us moving. The last thing we need is to slow down the economy even further because of people being out of work or flooding into our hospitals. My opinion is, with masks and proper social distancing, we will actually increase the number of people that can dine out at restaurants, even indoors. Roam around grocery stores, even shop for non-essential items. The mask traps respiratory particles, therefore they don't get into the air. If you're 6 feet away from somebody, those particles usually fall and hit the ground rather than circulate in the air so the next person inhales them. It works. The science is it works. The two most important things you can do are wear a mask, socially distance yourself, preferably 6 feet from other people. And if you're going to dine out, make the dining brief. All right, 3 things transmit the disease: the number of particles in the air, whether or not you're indoors or outdoors, and the number of hours you're exposed to potentially those particles. So follow the rules, and my belief is that things will get better.
Well, ladies and gentlemen, thank you for joining us for our session on the prolonged effects of COVID-19. Big thank you to Dr. Strange, Dr. Maniatis, Dr. Gutt, and Dr. Sullivan from Staten Island University Hospital, Northwell Health, for sharing all of those valuable tips. Stay safe, everyone.
Bye.